Tonight, we want to begin with a crisis many say shouldn't be happening here in the United States of America, a struggle for parents to get baby formula. We learned today that the White House is now scrambling to find a solution to the country's worsening shortage. President Biden spoke earlier with retailers and manufacturers and is trying to import more supplies from other countries. Nationwide, parents are doing whatever it takes to feed their babies, message boards, social media, and offering to swap formula. We're hearing stories from moms like one in Texas today who usually gets formula for free from social services, but she says they've been out of stock for 2 months. In 8 states and here in D.C., more than 50% of all formula products were out of stock, and an additional 28 states have stock shortages of more than 40%. Doctors and healthcare workers are urging parents to contact food banks or physicians' offices. And the big warning tonight, do not water down formula to stretch supplies. We have a lot of news to get to tonight, and CBS's Adriana Diaz will start us off.
For 19-year-old Jaylene Orellana from Houston, getting baby formula required a 3-hour drive to Austin.
It's hard physically, mentally, financially. Sometimes I do cry at night.
Orellana paid $120 for 3 cans for her 6-month-old Jaceli. She's among the 75% of American parents who rely on some formula for their babies.
What's the hardest part?
Not knowing if she's going to have formula.
The shortage intensified earlier this year when Abbott Nutrition recalled 3 of its top-selling formulas after 4 babies became ill with bacterial infections. That prompted the shutdown of its largest plant in Michigan. With empty shelves, parents are looking online, only to find eye-popping price gouging in some cases. This 27-ounce can of specialty formula usually costs around $40. It's now going for $129. The search is so widespread that social media groups have been created to connect people with extra formula with those in need. Ali Sekel runs the Formula Exchange.
They're having to drive several states over. They're having to ask friends and family. They're having to switch formulas like all the time. And some babies are fine with that. Others, not so much.
Pediatricians like Northwestern University's Dr. Joshua Wexler in Chicago are warning parents not to water down formula or follow recipes to make homemade formulas, which are dangerous.
There might be a lot of issues there that could lead to problems for babies, affecting their growth, affecting their ability to stay hydrated properly. So it's definitely not something we would encourage.
That's why Orellana bought extra formula that she plans to ship to other moms who asked for help online.
Why are you going that extra mile for other moms?
I know how it feels. You know, if they can't find it, if I find it, obviously I'll get it for them.
And Adriana joins us now. My heart breaks for so many of these families, people with young children like yourself. What is Abbott Laboratories doing about this?
Well, Norah, you're right. It is heartbreaking. And Abbott, which is based here in Chicago, says its plant could start back up within 2 weeks, but then it'll take up to 2 months for that new product to land on store shelves. In the meantime, the company is flying in extra formula from its FDA-registered plant in Ireland to help with supply.
That's an agonizingly long wait. Adriana Diaz, thank you.